Good morning. Myself Minu Miri, Assistant Professor from Department of Biochem, Sree Balaji Medical College. Today's topic for the lecture is Free Radicals and Antioxidants. And the competency number is BI 7.6.1 to 7.6.3 and 7.7.1 to 7.7.5. And the SLOs are to identify the free radical, different types of free radicals, and the generation of the free radicals and types and functions of antioxidants. So first we'll see the definition of free radicals. So free radicals are molecules or molecular fragments that contains one or more unpaired electrons in its outer orbit. So as we know, a normal healthy atom or molecule usually has a paired electron in its outermost shell. But in a free radical, it is unpaired. As a result, they are highly reactive. These free radicals are represented by a superscript dot, and they are highly reactive, as I said. So it is attacking the next molecule. So they are autocatalytic reactions. Molecules with which they react are themselves converted into a free radical and to propagate the chain of damage. So the free radicals are also known as reactive oxygen species or reactive nitrogen species. The reactive oxygen species are usually produced as a product of the partial reduction of oxygen. The important characteristics of these reactive oxygen species are they are extremely reactive, they are having a short lifespan, only few milliseconds, and the generation of the ROS by the chain reaction, and that can lead to various tissue damage. The different types of free radicals or the free radicals are, as I told you, they can be reactive oxygen species or reactive nitrogen species. The examples are superoxide anion radical, hydroperoxyl radical, lipid peroxide radical, hydroxyl radical, hydrogen peroxide, singlet oxygen, nitric oxide, and peroxynitrite. Among this, the hydrogen peroxide and singlet oxygen, they are not a true free radical, but due to their highly reactive nature, they are included as a free radical. And this nitric oxide and peroxynitrite are derived from the nitric oxide, hence they are known as reactive nitrogen species. Next, coming to the generation of free radicals. The free radicals can be produced due to cellular metabolic reactions or even due to the environmental factors. The cellular metabolic reactions we'll just see, that is, first is the leakage of electrons from the electron transport chain. This happens mainly in the mitochondria. So the mitochondria is a major site for the reaction where the superoxide anions are produced. Next is the production of hydrogen peroxide and oxygen by the xanthine oxidase and NADPH oxidase. That is, during the purine metabolism, the hydrogen peroxide or oxygen radicals are produced. Next is the lipid peroxidation. That is mainly the PUFA, that is polyunsaturated fatty acids that is present in the membrane are prone for this lipid peroxidation. Next, peroxisomal generation leading to oxidation of hydrogen peroxide and oxygen molecules. Next, during the prostaglandin synthesis, production of nitric oxide from arginine, and during phagocytotic reaction, that is known as the respiratory burst, and in the oxidation reaction of heme 2, the synthesis of bile pigments, and also in auto-oxidation of the metals like iron, copper, glutathione, and ascorbic acid. So these are the different metabolic reactions where the free radicals are produced in our body. Not only in the cellular metabolic reactions, but due to the environmental factors like cigarette smoking, then exposure to UV light, or X-rays, that is resulting in the end product of the result of the drug metabolism, cytochrome P450 related reactions in the detoxification, photolysis of oxygen by the light, photoexcitation of organic molecules, and alcohol also results in the production of free radicals. So this is the outline of this free radical formation. So as a result of the free radicals, like a UV exposure, that is radiations, usually results in the formation of hydroxy radicals. The cigarette smoke contains maximum amount of free radicals like a oxygen radical, hydroxy radical, nitric oxide radicals. Even the pollution, air pollution, then the phagocytic reaction, from the electron transport chain, the hydroxy radicals produced, and the singlet oxygen produced by the UV rays, all this finally result in the DNA damage, which can lead to mutation and cause many diseases. Next, coming to the lipid peroxidation, which is usually the end product is the MDA, we call it as malonyl dialdehyde. This malonyl dialdehyde is the biomarker for the free radical estimation. So this lipid peroxidation occurs in 3 different phases. First phase is the initiation phase, second propagation phase, and the third is the termination phase. In this initiation phase, the PUFA, the fatty acid PUFA, polyunsaturated fatty acids mainly attacked. So from the PUFA, the hydrogen atoms are removed by the help of the hydroxy radicals. So this results in the formation of the fatty acid radical. Now this fatty acid radical enters into the second phase, that is the propagation phase, where the fatty acid radicals takes oxygen and forms peroxy radicals. And this peroxy radicals will remove the hydrogen atoms from other PUFA molecules and results in the formation of lipid hydroperoxide. This hydroperoxides can stimulate further lipid peroxidation and causes the formation of alkoxy and peroxyl radicals. And as a result, the end product we are getting the aldehyde form is malonyl dialdehyde, which is used as a marker for this estimation of this lipid peroxide of free radical. And the last phase is the termination phase. So this lipid peroxidation continues until the PUFA gets completely oxidized. So these free radicals can cause different harmful effects. We'll just see the topic, harmful effects of free radical. The free radicals can damage the biomolecules like proteins, lipids, carbohydrates, and nucleic acid. The protein damage, we'll just see. The proteins, as we know, it is mainly made up of amino acids, and they can destroy the structure of the protein. The free radicals can cause the oxidation of the sulfidyl groups, and modification of certain amino acids are done by this free radical. The ROS may damage even the proteins by fragmentation, cross-linking, and aggregation. The lipids mainly, as I told you, it is the PUFA which is affected. They are mainly damaged by the free radicals, leading to lipid peroxide formation. The carbohydrates, they get glycated and they can attack the glycation increases the susceptibility of the proteins to the attack by the free radicals. This can result in the disease conditions known as diabetes mellitus. The oxidation of the monosaccharides like glucose can also produce hydrogen peroxide and oxoaldehydes. Next, coming to the nucleic acid, that is mainly the DNA will be affected. The free radicals may cause the damage in the structure of the DNA, causing a break in the strands or fragmentation of the bases and deoxyribose, which can lead to mutation of the DNA. So, the outline of the damage caused by the ROS. So, ROS is destroying the structure of lipids, proteins, and DNA, where the lipid peroxidation happens, which will damage the membrane, which will lead to the cell death, where the proteins, the carbonyl formation happens, which will affect even the structure of the enzymes, because enzymes are nothing but made up of proteins. So the enzyme function will be lost, and in the condition of DNA, the altered gene expression will be seen, which will lead to mutation, and finally the end what you are seeing is it is leading to a cell injury. Next is coming to the clinical significance. The chronic inflammation conditions like rheumatoid arthritis are the self-perpetuated by the free radicals released by the neutrophils. The ROS-induced tissue damage appears to be involved in the pathogenesis of chronic ulcerative colitis, chronic glomerulonephritis, and so on. Next, the acute inflammation condition. At the inflammatory site, the activated macrophages produce free radicals, respiratory burst, and increased activity of this NADPH oxidase are seen in the macrophages and the neutrophils. Next, respiratory diseases. The direct exposure of our lungs to 100% of oxygen for a long period can lead to destroying the endothelium and can cause the lung edema. This is usually mediated by a free radical. The ROS are also responsible for the adult respiratory distress syndrome. A characteristic is seen by the pulmonary edema. The cardiovascular disease, which is mainly due to the lipid peroxidation, where the oxidized low-density lipoproteins formed by the action of free radicals will cause atherosclerosis and finally coronary heart disease. Next, cancer. It's mainly due to the DNA damage, which is caused by the free radicals. It will lead to the mutagenicity and cytotoxicity, which plays a major role in carcinogenesis. Next is diabetes mellitus. It's mainly due to the destruction of the islets of pancreas, which is a major cause for the pathogenesis of insulin-dependent diabetes mellitus. Next is cataract. It is mainly due to the oxidative stress, which lead to the production of free radicals, which can cause the cataract formation. It can also affect the aging process. The reactive oxygen metabolites play a major role in the degenerative brain disorders like Parkinsonism, Alzheimer's, dementia, and multiple sclerosis. The cumulative effects of the free radical injury cause the gradual deterioration in aging process. The free radicals can also cause male infertility due to the reduced sperm motility and viability. So the outline is, the free radicals can affect the multi-organ in our body. It can affect the brain, eye, lung, joints, heart, kidney. Different organs will be affected. Next is coming to the beneficial effect of the free radical. The only one beneficial effect in the free radical is the bactericidal action by the phagocytes. So during the course of phagocytosis, the inflammatory cell, particularly the macrophages, consume large amount of oxygen and produce a superoxide ion. This is mainly done with the help of the enzyme NADPH oxidase, and this process is known as respiratory burst. This oxygen radical that form gets converted to hydrogen peroxide and then to hypochlorous acid with the help of myeloperoxidase enzyme. The superoxide anion radical along with the hypochlorous ion brings about this bactericidal action. Next topic is antioxidants. They are nothing but the free radical scavengers. So they can either prevent or they can destroy the free radical that is present. So we can say antioxidants are substances that delay or inhibit the oxidative damage. The antioxidants are mainly present in many foodstuffs, and also it is produced during the metabolic reactions. It is present in our body, and they are classified according to their position, according to their function and nature. So first is according to the function, like lipid peroxidation, related with the lipid peroxidation. They are classified into two: preventive antioxidants and chain breaking antioxidants. The preventive antioxidants will block the initial production of the free radicals, and the examples of the preventive antioxidants are catalase and glutathione peroxidase. The chain-breaking antioxidants inhibit the propagative phase of the lipid peroxidation. Examples are vitamin E, superoxide dismutase, and uric acid. Next is classification is according to the location. So in plasma, the plasma antioxidants are beta-carotene, ascorbic acid, bilirubin, uric acid, ceruloplasmin, and transferrin. The antioxidant that is present in the cell membrane, they are vitamin E, that is alpha tocopherol. The intracellular antioxidants are the enzymes superoxide dismutase, catalase, and glutathione peroxidase. Next classification is according to the nature and action. That is the enzymatic antioxidant and non-enzymatic antioxidant. The enzymatic antioxidants are 4: superoxide dismutase, catalase, glutathione peroxidase, and glutathione reductase. The non-enzymatic antioxidants can be again of two types, which can be obtained from the metabolic reaction or through the diet. Through the diet, we call it as nutrient antioxidants. They are carotenoids, alpha tocopherol, selenium, and vitamin C. The metabolic reactions are glutathione, ceruloplasmin, albumin, bilirubin, transferrin, ferritin, and uric acid. Next come to the functions or the superoxide dismutase, glutathione, and catalase function, how it functions. We'll just see. So the superoxide dismutase, which is an enzyme which is usually seen in the mitochondria. Here it converts the superoxide anion that is produced from the electron transport chain to hydrogen peroxide and oxygen. This is the first line of defense to protect the cells from the injurious effects of superoxide ions. Next is the glutathione peroxidase and catalase. They will reduce this detoxify this hydrogen peroxide to water. During this reaction, the reduced glutathione will be converted to oxidized glutathione. And this oxidized glutathione will be again converted back to the reduced form and it is reused. So the reduced glutathione can be regenerated by the glutathione reductase with the help of this NADPH. And this NADPH is obtained mainly from the HMB shunt. Next is the catalase. Catalase also helps in metabolizing the reaction of hydrogen, removing the hydrogen peroxide to water. So this is the function of the enzymatic antioxidants, superoxide dismutase, glutathione peroxidase, and catalase. So just an outline, we'll just see it is the free radical antioxidants. The free radical and antioxidants interplay is very, very important for the normal functioning of our healthy body. Thank you. So the summary of this topic is understanding the interplay between the free radicals and antioxidants is very important for maintaining the cellular health. So antioxidants are usually present in many fruits and vegetables. So it is better to take this antioxidant containing foods in your diet because it's really good to neutralize the free radicals and thus preventing their harmful effects. Thank you.